So my name is Benjamin Rawless. I'm an MD and research fellow in the Mullally lab. And we are very much interested in MPNs, so myeloproliferative neoplasms. And as many people of your audience will know, MPNs are chronic diseases, so people live for years and decades. But also there are some young patients that have MPNs. And at the Dana-Farber Cancer Institute, for example, we have a lot of patients, young patients with TP53 mutation. And right now there is no clinical guidelines how to deal with these patients. So due to that fact, we screened MPN patients that were treated at the Dana-Farber Cancer Institute. Right now in our current database are 947 MPN patients, and we screened these patients for TP53 mutation. And 40 patients had a TP53 mutations. And now we are very much interested in further characterizing these patients. And we checked if how many of these 40 patients had a single hit or a multi-hit TP53 mutations. And we found out that 27 of these patients had a single hit mutation and 30 patients had a multi-hit. So multi-hit was defined by us by a TP53 mutation with a variant allele frequency over 50%, with 2 or more TP53 mutations, patients with a TP53 mutation and loss of heterozygosity, or a TP53 mutation and 7TP deletion. And the 2 main findings of our studies were, first of all, that close to every patient that had a TP53 mutation had a bone marrow fibrosis. That was finding number 1. And the second interesting finding was that the survival did not really differ between patients that had a single hit TP53 and patients that had fibrosis, showing that worse survival in single hit TP53 patients were mainly driven by the bone marrow fibrosis itself. But TP53 multi-hit patients had a significantly decreased survival. So for most analysis that we planned, we are right now underpowered. Due to that fact, we like to increase our cohort. We want to recruit more patients from the Dana-Farber Cancer Institute, but also from other big American cancer centers to find out, so as an overall goal, to further characterize TP53 mutations in MPN patients by zooming into the group of multi-hit and single-hit TP53 patients and find the factors that really drive prognosis. And the overall goal is really to kind of create clinical guidelines how to deal with young or old MPN patients that have a TP53 mutation.